join me in thanking Natalie Kelly for presenting on this important topic.
Thank you. Thank you. Thank you. How many people are here because they have a brain injury? That's almost everybody. Great, welcome. How many people are here because they love somebody or work with somebody or dealing with somebody who has a brain injury? Great, so that's another like a third of the room. Thank you all so much for being here. I'm Natalie Kelly. I sustained a traumatic brain injury in 2010, so that was 6 years ago. It happened during a sailing accident that happened during a large storm right here on Lake Champlain. And the boat, I was in a storm and I got flipped right over a boat with tremendous force, and then the boat landed on my head, so it was both a twisting accident and a coup contra coup accident that occurred to me. I was left with many, many deficits that you're all very familiar with. I had extreme dizziness and visual processing issues. It took me about a year before I didn't feel any longer like I had drank 3 six-packs. And it took me 4.5 years to walk again without assistance. So I have been through quite a journey, and I'm here to tell you what I have learned. And I'm so excited because I have had this vision for 6 years that I was going to help other people and teach people how to do this. So here we are, and I'm really excited. So what do you do when you have a brain injury? You go to your doctor, right? So I went to my doctor. And then if your doctor doesn't know what to do with you, what do? You go to another doctor, right? Does this sound familiar? So in all, I went to 5 doctors. I went to 4 neurologists. I went to a physiatrist, a neuropsychiatrist, 3 neuro-ophthalmologists, 2 ENTs, 5 behavioral optometrists. I went to rehab. I went to occupational therapy, speech and language therapy, and 6 physical therapists. And then in Stanford University, I was their neurology patient of the month, where a panel of 12 doctors were evaluating my case. So I was thorough and persistent in trying to find some help. Does this sound familiar to anybody who's been to a ton of doctors? It's a common story. What the doctors told me was everything in this range from dismissive to insulting to this is very severe. And what I heard was this: there's nothing wrong with your brain. I heard it's just an anxiety problem. Which case I actually wanted to turn to the doctor and say, well, you'd be anxious too if you couldn't understand anybody and the floor was undulating and you couldn't walk in a straight line and nothing worked the way it was supposed to work. Got it. Thank you. But my head was too scrambled to have such snappy comebacks. I heard it's all in your head. I love that one. I'm like, well, I don't have a traumatic foot injury, right? I heard from a neurologist in San Francisco who was well respected, I heard, well, your MRI shows nothing wrong, so this doesn't make any sense. Have you seen a psychiatrist? That was my favorite. I got a dementia diagnosis at the age of 46 from my first neuropsych evaluation. It's not what you want to hear when you're 46 years old, so actually I didn't hear it till I was, I think, 51. I think I was too scrambled and I couldn't read, so I didn't know about this until recently. I kept going to doctors because I knew something was serious and I couldn't figure out the answer. So when I went to 4 years of Fanny Allen rehab here, the physical therapist who works with the state of Vermont said I had the most persistent case of dizziness and disorientation she had ever seen, because after 4 years of rehab, she told me to turn my head and I fell over, fell on the floor and couldn't get up for the next hour. So then I started going across the country because I was spending winters with my parents in San Francisco so they could take care of me. And I had the great privilege of working with doctors over there as well. So I've got both coasts covered. And I thought that that might be the answer. And when I finally found that 36th doctor who got it, she told me that what she saw was one of the worst cases of visual disturbance she had ever seen. And oh my God, how was I functioning at all? And I can't tell you how incredible that was to be validated for what I was going through and experiencing. So does any of this sound familiar to those of you with brain injuries? It's a really common story, and this is one of the things that makes me passionate about this, is I hear it all the time. I get contacted from people all over the world. I have a YouTube channel and I coach people with brain injuries. And I'm in touch with people from all over the world, and it's not just United States, it's everywhere people are hearing this. The medical director of the Brain Institute of America came out last year with a great article, and what he said was that they don't teach brain injury in medical school. I was shocked. I was like, I'm finding this hard to believe, but maybe that makes sense. I asked some people who are currently in medical school, and they said, yeah, that's right. We didn't really learn anything about brain injury other than what to do the first few days or few months in the acute period. There's nothing that we learn in medical school about brain injury. And I went, oh, that's interesting. This is starting to make sense. We all need to know this, right? We think our doctors are the experts, but we need to know that they may not have studied it. We need to know this so that we can seek out the doctors who have studied it and who are passionate about it and not just waste our time going to 36 other practitioners who don't get it. Furthermore, when you look at the old medical textbooks, issues for people that were post-concussive, meaning after you have a concussion, if you still have issues, it was considered in the medical textbooks to be histrionic. Now, what does that mean? That means emotionally based. That means you have an emotional psychiatric problem. And interestingly enough, the word hyster comes from the Greek word womb, like hysterectomy, hysterical. It's a female thing. When women are too emotional, we call them hysterical, and they have histrionic brain issues. So just to give you a little bit of that little political thing to just say, this is kind of a background of where we're coming from. So this is why we're hearing these things from our doctors. And it makes sense when you start to learn about the issues. So what did I do? I wasn't willing to take no for an answer. I was lying on the couch for years. I could barely open my eyes. I couldn't turn my head. I could barely walk. I have a child to take care of. I lost my job. I lost my ability to do anything I liked to do. And people were telling me this was forever. And I was like, you gotta be kidding me. Like, no, I'm not gonna live like this. I won't make it. So I'm gonna do everything I can to try to figure out how to get my brain back. I have this wonderful background in complementary and alternative medicine, which was an advantage for me. I'm one of the people who was there at the founding of Eastern View Integrative Medicine. So I have a very vast network of complementary providers as my friends. And I knew a lot about healing, and my job as a hypnotherapist was neuroplasticity. My profession was that I gave input to people's brains that would help them create a change in their behavior and their body, and I had seen miracles. And I knew this was possible, and I said, you know, just because the doctors haven't figured this out doesn't mean it's not possible. We just haven't figured it out yet. So I'm gonna be the guinea pig. I gotta figure this out for all of us. I did all of the complementary healthcare modalities that you can possibly think of, just about. I went to 38 practitioners. It was very busy for somebody who doesn't drive and struggles with motion. But I was very determined to not live my life on the couch in a dark room. So I know that this sounds very overwhelming. You don't need to do all of these things that I did. You just need to take one step. So I'm going to talk to you today. When I think about all the things I did, there were so many things I wanted to talk about. I could have filled this entire conference with information, but they only gave me your attention for an hour. And thank you for that. And so I narrowed it down to my top 6 things that I thought would be most helpful for most people. It might feel overwhelming. If you have a brain injury and you're at this conference, I'm gonna let you know, the first many years I came, I couldn't sit in a workshop. I had to leave after 5 minutes, so I understand. If you need to leave, I won't take it personally, and this is videoed so you can get the information. But what I want you to do is just focus on one step that you're gonna take so you don't feel like you need to do it all at once. This was a 6-year journey for me. So as you're listening, focus on like, that makes sense, I'm gonna do that one. So as you take these steps, because you have a brain injury, it's gonna feel like this. You don't know if you're going forward or backwards, or if it's up or down, or what's happening, because part of what we have to do to get our brains better is push them so we feel worse before we feel better. And that sucks, because we already feel awful. You're not going to know until over time that you're making progress. And what I could tell you from most all of the treatments and the complementary modalities that I did, what I saw was, in most of them, that I would progress a little bit, and then I would stop progressing. And then I would try another thing and progress a little bit and stop progressing. And it's been really a staircase, a stair step of progression. It hasn't been the spontaneous healing I was looking for. In fact, I changed the title of this talk from how I got my brain back to how I'm getting my brain back, because after a few really bad days this week, I was like, yeah, let's get real. We're still struggling. So let's talk about, what does this mean to get better? When you have a brain injury, what does that mean? So here's you before your brain injury. It's you version 1.0. So you could see this person, wow, what a lot of energy that person had. Strength and vitality and energy, that's 1.0. Here's the version 2.0 of you with a brain injury. So you can still, it's still the same person, it's a little shakier, but that's the new you. So this took me a long time to understand, and mostly because my brain was so scrambled. But getting better doesn't mean getting back to version 1.0. And that's the only measuring stick we have in our heads, right? Well, getting better means getting back to who I used to be, is function. So I want to give you a different model that this person is no longer there. This is like you were once a baby and you were once a child, and you can't get back to that either. So what you have is what you have right now in this moment, and that is version 2.0 of you. And that person can make improvement and get better. So does that make sense to people?
Yes.
Is that a helpful model? Anybody else have a hard time grasping that because of their injured brain? Yeah, so it's the new you can get a lot better, but it's going to be a new you. Acceptance is the really hard thing. Yeah. It's a journey in self-love and self-acceptance, and this is the PhD course. It's the hardest thing there is. I hate to be the bearer of that news, by the way, because that's just something I didn't want to hear or accept. But look at me now. I learned Keynote this week. I learned how to make all these slides. I'm standing in front of you in a bright light, and my life is so much better than it was even a year ago, and I'm on year 6. So I say I've made my biggest progress in this last year because I have done a lot of these modalities. So on my journey of trying to be detective and figure out how to heal my brain and how does this brain work anyway, here's your first clue. What do they say when you go to the doctor and they want to know if your brain is working okay? What do they say? They say, follow my finger. They're looking at your eyes. So there's a really great TED Talk that was illuminating for me by Dr. Uma Samadani, a neurosurgeon. She works with people who are severely brain injured, and she can't tell if they're getting better or worse or what's happening with them because they can't communicate. She took data of thousands of people and their eye motion. And when she compared all this data, was shocking. She said, I can see exactly what's happening in their brain by looking at their eye motion, which is very different from somebody who's not injured. So I can see if they're getting better. I can see if they're paying attention. I can see exactly what part of their brain is injured. This is revolutionary. So a lot of people say that the eyes are the window to the soul. You've heard that. So what she's saying and what I'm saying is the eyes are the window to the brain. So this is your clue. One of the things that I learned on this journey that I thought was fascinating, and this explains why the eyes are so important, is as embryos, when we're developing embryologically, our eyes grow out of our brain tissue. They're extensions of brain tissue. They're not separate. We, in this Western world, think of our body parts as separate. These two are not, none of our body parts are separate, but these two are very intertwined. And I love this diagram because you can really see that. So 2 of my top choices today, the 1st and the 6th, are going to deal with eyes and vision. So in looking at my top 6 things that I have found to be most helpful in my recovery, and everybody's different, but I think I picked ones, I didn't pick the more esoteric ones that have been more helpful for me. I picked ones that I thought would be helpful for most people. So number 1 is behavioral optometry. Number 2 is reducing inflammation. Number 3, citicoline. Number 4, neurofeedback. Number 5, pulsed electromagnetic fields, or PEMF. And number 6, chiropractic neurology. So these are probably things you may not have heard of or tried. Number 1, behavioral optometry. So behavioral optometry is like a personal trainer for your eyes. Try to find a metaphor for all of these things, for those of us who are more right brain. So this is like a personal trainer for your eyes. Who here has gone to a behavioral optometrist? So 4 people out of this room, 5. That's not very many. I'm hoping that more people will go after this talk. Behavioral optometrist recognizes that 20/20 vision is not enough. 20/20 is one aspect of our vision. My vision is actually better than 20/20. To see properly, there's 20 visual abilities needed, and they will address those. None of the other doctors that I saw were addressing much else other than the 20/20. And they were like, "You're fine." I'm like, "No, I'm not." Here are common visual symptoms of brain injuries. Raise your hand if you have light sensitivity, double vision, convergence issues, blurred vision and inability to focus, loss of peripheral vision, eye movement difficulties, difficulty concentrating, headache with visual tasks, comprehension difficulties, reading difficulties, balance and spatial orientation. I'm like, I have goosebumps right now. For all of those, I'd say half of the hands in this room were up. That's really profound. That's a lot. This points to the eyes are the window to the brain. This is a little fuzzy, but this could be 20/20 vision. That's what my vision looks like. I have 20/20 vision. That's not enough. If you move your eyes and you have vision like that, it's going to make you really dizzy and fall over and nauseous. So what a behavioral optometrist will do is work with particular tools. They have tools in their tool bags that are pretty unique. And what I love about it is that they're mostly very low tech. So it's kind of like going and playing like a little kid sometimes, except it's nauseating and not as much fun. So they will use things like lenses, prisms, which will change the direction of the way the light is entering the eye, which will, I have prisms, I put them on, they make me happy, my whole body goes, oh, thank you. They'll give you occlusions, which will block out either your central vision or your peripheral vision. It's just a piece of tape on your glasses, and that helps a lot of people. They'll give you vision exercises like our friend the Brock string here. Anybody use this before? Anybody find it really difficult? Yeah, this is really hard. I used to do 6 seconds and then sleep for an hour and then do it again. And I have found that, well, I don't want to go too far into this, but doctor number 36 helped me figure out how to do it. And it had to do with putting weights on my body to calm things down before I tried it, is one of the things. They'll also work with syntonic therapy, which is colored lenses and colors, which I have used syntonic therapy, which I love because it's painless. It doesn't make me feel bad. I stare at a green light for 10 minutes at night before bed, or wear green glasses. They calm my nervous system down, and just staring at a green light doubled my peripheral vision in 2 weeks. Really amazing. And this is just colors. So behavioral optometry is actually considered unorthodox. I looked it up in Wikipedia before I came here and said it was unorthodox. It departs from conventional optometry, and this is what you're going to hear from the neuro-ophthalmologists is don't waste your time and money. I'm going to say waste your time and money because what else do you have to lose? They don't have anything to offer. There is evidence of success with behavioral optometry, regardless of the unorthodoxy of it. The behavior, one great book is called Fixing My Gaze by Susan Berry. She also has a TED Talk. She was born with strabismus, where she was cross-eyed, her brain got 2 pictures of everything, told it was not fixable. At age of 42, mostly using this Brock cord string, she learned how to bring her eyes together and converge, and fixed her vision, which was told to be impossible. There's no such thing as a plastic visual system. She did it, and she tells the tale and teaches about it now. So she fixed her vision using behavioral optometry, and so did Dr. Clark Elliott, who wrote this amazing book called The Ghost in My Brain, How a Concussion Stole My Life and How the New Science of Neuroplasticity Helped Me Get It Back. He used behavioral optometry also and has what he says is 0 lingering effects from his concussion after 7 years of being really struggling. He fixed it fairly rapidly using behavioral optometry techniques. So this is supposed to be on your handouts, but local practitioners who are using this are Dr. Jay Kimberly. There's somebody in Schenectady, New York, Robert Fox, who's like the guru of the syntonic therapy, if you can get to him. I've also heard great things about Kevin Chauvette in Merrimack, New Hampshire. I had my best results with Dr. Lori Chaikin in Alameda. Like I said, I have gone to 5 behavioral optometrists, and I've learned something different from every one of them. So just because you've gone to one doesn't mean you've exhausted that path. If you want to learn more about vision with brain injury, I'd highly recommend that you see my video interview with Dr. Lori Chaikin on my website, thetbicoach.com. She is amazing. She's my Dr. 36 who helped figure things out and will have so much information to share with people that will be very validating for brain injury. And now we're going to move on to number 2, reduce neuroinflammation. This is like a pressure relief valve for your brain. How many of you even heard of neuroinflammation before? That's 3 people in this room who are brain injured who've heard of neuroinflammation. I hadn't heard of it either until I read this book, which is not an easy read. Highly recommend this book. Why Isn't My Brain Working? So this seems to me to be a very missing piece in our medical care. I don't know why all of us have brain injuries. Nobody has told us about neuroinflammation. You could do all the eye exercises in the world, and if your brain is inflamed, you won't make a whole lot of progress. You've got to reduce the inflammation. So that's why I'm including this, because nobody's talking about it. So when we have an injury, we have inflammation, we have swelling. If there's swelling in your brain, it actually doesn't hurt, it's painless, we don't know it's there. But it will accelerate brain degeneration, and it will impede brain function. It's said that post-concussive syndrome following a TBI may represent a persistent, low-grade, chronic, smoldering neuroinflammatory response. Because what happens in our brains is the microglia gets overactive. The little cells in our brain get overactive, and there's something called inflammatory cytokines that don't have an off switch in our brain like they do in the rest of our body. So they just continue to inflame and inflame and inflame, and it could go on for a very long time unless you're dealing with it and addressing it. There's also something called leaky brain syndrome. Part of our brain is the blood-brain barrier, which is a really important filter And what it does is it filters out all the particles in our body, in our bloodstream that do not belong in our brain tissue to keep our brains safe. What they're now discovering is that people with traumatic brain injury sometimes have a leaky blood-brain barrier. So particles are getting in that do not belong there and interfering. So this needs to be addressed. I think this is a really big issue. There is a test in that book called the GABA Leaky Brain Challenge that you can do at home with this pill called GABA in just one evening and learn if you have a leaky brain. A leaky brain will continue to create more inflammation. And there's a wonderful YouTube channel by Dr. Martin Rutherford that talks about this. I'll have that written down at the end. Dr. Martin Rutherford is a functional neurologist who has great videos on YouTube where he really goes into depth in all of this. So what I'm giving you today is a little appetizer. I'm putting little breadcrumbs on the trail for you, and you're gonna have to follow those breadcrumbs because I only have an hour. Here's some things that you can do to reduce your brain inflammation. One is an anti-inflammatory diet. I used to be vegetarian, now I eat a paleo diet because I'm pretty convinced that that's better for my brain after watching and interviewing Nora Gedgaudas, another video I'd recommend you watch on my YouTube channel, Eating for Optimal Brain Function. She talks all about neuroinflammation. Very important to balance our blood sugars if we have brain issues. So how do we do that? We eliminate sugar and alcohol and simple carbohydrates. We stop feeding ourselves cookies and bagels at the support groups, and we eat more protein and fat, which slows down and regulates your blood sugar. It's the log on the fire as opposed to the kindling on the fire, which is the sugar. So we need healthy fats, like a lot of healthy fats, coconut oil and avocados and olive oil. We need to reduce our stress, and flavonoids also will help reduce inflammation. So these reduce inflammation, omega-3 fatty acids, fish oil. I like the Nordic Natural fish oil brand because it's cleaner. Vitamin D3 is really important. Curcumin, which is the anti-inflammatory ingredient in turmeric. You might have heard of turmeric. Resveratrol, green tea, and magnesium have all been clinically shown to reduce inflammation and reduce microglial activation. So these are just some ideas for you. You're going to have to research this with your healthcare providers. Functional neurologists, neurologic chiropractors know a lot about this, and so does that book. So here's some resources. These are the videos I've been telling you that are full of this information. They're very scientific, so they might be a little heady. But that's a lot of great information. Is Dr. Martin Rutherford on YouTube. His videos on concussion are really great. And I'm going to move right along to number 3. So this is one of my favorites. What I love about citicoline is it's inexpensive and easy, and it really works well as the fog lifter. So who here has brain fog? I used to have brain fog. I don't have brain fog anymore. Citicoline is like, I grew up in San Francisco. Every summer it looks like this. And as soon as school starts and you want to go outside and play, the fog lifts. So citicoline is like September in San Francisco. It's the fog lifter. It's naturally occurring in the body. It's developed in Japan for stroke. In Europe, they prescribe it for head trauma, which is how my doctor heard about it. It increases phosphatidylcholine, acetylcholine, and dopamine, which are all very important for brain function. It's neuroprotective, possibly reducing brain tissue damage and decreasing inflammation. We talked about how important that is. And early studies on it show that it possibly improves memory, learning, and speaking ability in brain trauma. How many of you would like that? Yeah. So this is available on Amazon. It's $30 a bottle.
It's one of the more easy, affordable treatments that I'm talking about today. My doctor recommends people start with 500 milligrams a day. After 2 weeks, you can up it to 1,000 milligrams a day. And if you want more after 6 weeks, you can do 2,000 milligrams a day. I find 500 is enough for me, so I stopped there. The other thing about the bioflavonoids I was talking about is you might have noticed that the doses were extremely high. So that's one of the things we're kind of not getting right is the fish oils and the green tea and the curcumin. You need a lot of it to make an impact. So those doses were very high. And like this, you gradually increase yourself up to that dose till you see a difference. I'm not a doctor, I'm just telling you what I've heard. All right, what are we on? Number 4 out of our 6 is neurofeedback. Neurofeedback, has anybody here done neurofeedback? Your son, great. So that's 2 people have done neurofeedback. Neurofeedback has been shown to be very effective with brain issues of all kinds. It's a type of feedback that uses biofeedback, which means there's a computer connected to your body. It's reading what's happening in your body, connected to your brain. Shows a real-time display of brain activity to teach self-regulation of brain function. So it's essentially like a mirror for your brain. There are many types of neurofeedback. The one that I did is called brainwave optimization by virtue of the person who's closest to us, who's locally doing this and experienced with brain injury, does brainwave optimization. So that's how I chose that type. I've also heard good things about the lens type, and I've also heard good things about Loretta type. So how this works is it's like a mirror for your brain. So you know how you go to the bathroom and you look in the mirror and you realize, oh my God, I've got spinach in my teeth? And you just kind of like automatically just go get the spinach out without really thinking about it. And you just kind of correct it or smooch on your face and you're like, okay, good. And you walk out the bathroom, you're good. So what neurofeedback will do was teach your brain, give an input to your brain to show your brain what it's doing in real time. And your brain goes, oh my God, I'm doing that? I had no idea. Let me correct it. So with brainwave optimization, you do 7 2-hour sessions. A lot of other types, you do like 20 to 40 sessions. And it will affect everybody differently because all of our brain injuries are different and all of our brains are different. But I can tell you what it did for me was it reduced my anxiety and it reduced what I call my out-of-body experiences, where I just kind of would be driving a car and suddenly have no idea where my body was and I had no idea how to get back into my body. Does that sound familiar to anybody? Mm-hmm. So you know that feeling. Bryn Perkins does it. So it stopped those. Here's kind of what you see. And one of the things I loved about this neurofeedback was it was the first time I could see what my brain was doing. There was measurable data that I could see of what it's doing. This is not me, but this is showing you how there's a yellow and a red line. It's the left and right brain hemispheres, and they're supposed to be in sync with each other. They're supposed to be doing this, and here's Bryn right now. So this is Bryn, who does the neuro optimization, and she's got a table here at the conference, so if you want to learn more, she's your gal. So you can see in the beginning here, this person, their brain waves were not in sync, and then after their treatments, the frequencies lowered and they became synchronized with each other. And then they stay that way after your sessions. So it's just a little mirror for your brain to get the message of, oh, I need to fix this, because our brains just need a little nudge. And this is a great tool to give them that nudge. So locally, we have Bryn Perkins who does this. Nationally, for those people on the video or in other places around the country or world, you can find practitioners at any of these websites. All right, I've got 2 more things. How are y'all doing? Hanging in there? I know this is a lot of information. So this is number 5 I've discovered this recently and I'm so excited about it. It's called pulsed electromagnetic fields. And what this is it's like when your battery on your cell phone is dead and it doesn't work anymore and you charge it into the electricity and then it's good to go again. So this is that for our entire bodies. So what it looks like is this. You're laying on a mat. There's a computer that controls the input. And what you're receiving from the mat is natural earth-based frequencies of 0 to 30 hertz. So this is the electromagnetic field of the earth itself. It's very natural. Hundreds of years ago, we would have been getting this constantly, but we're not anymore. So this is FDA approved, by the way, and it's approved for depression, shown that it helps with depression also. And because I forgot to say it earlier, wanted to let you know when we were talking about inflammation, that recent research is pointing to inflammation being the cause of depression. So another good reason to reduce your inflammation. I was just talking about the frequency of the Earth from this pulsed electromagnetic field. When astronauts would go into space, they started getting really sick and people were trying to figure out what was going on. NASA did the research on this. What they discovered is that they were missing the electromagnetic field of the Earth and that we need that for our health. So they are now using this technology in underwear for the astronauts to help them keep their health when they're out in outer space. So you know how when you lay on the beach for a few hours, you feel really good? Or if you walk barefoot? Our skin needs to be connected to the earth, and the rubber from our shoes and the concrete and the asphalt are all interrupting that electric signal. And this is my personal theory about brain injury, just me. I'm convinced this is an electrical issue, in part. I think that the brain is an electric machine, an electric being. When the signal is disrupted, the electricity is still flowing, it just doesn't know where to go. It just kind of interrupted, it creates static. So that's why we all feel like we have this static in our head, like this white noise all the time. Do you know what I'm talking about? Raise your hand if you know the feeling of like static in your head. Yeah. It needs to be grounded. So I spend a lot of time walking barefoot on the earth because it needs to be grounded, and that's how we ground is into the earth or with this machine. So this machine has 20 years of research, 10,000 research papers, 2,000 double-blind studies. They're using it now in Germany in the ambulances as their first line of defense. So it's got some science behind it. NASA claims that compared to all the other things they studied, this was their preferred mode of healing. They show physiological and molecular genetic effects of this field on human neuronal cells, meaning your brain cells.
Is this the same thing as the beamer?
Yes. The beamer is one brand of it. What happens when you're exposed to this field is this. This is your blood, red blood cells right now. They get sticky. They clump together, and then they can't flow through your capillaries, so you don't get the kind of circulation you need. And it also, because they're sticky, they don't have 360 degrees of ability to absorb their nutrients, their water, their oxygen, and detoxify. So if you lay on this mat after 8 minutes, this is what your red blood cells look like. Suddenly they're flowing so much faster through your body, you get more oxygen, more nutrients. It increases ATP production in the mitochondria, which is the energy for your cells. This is the plugging that cell phone battery into the energy source. You get 50% more oxygen in your body and brain. It helps you detoxify, and super important for us with brain injuries, it helps regulate the autonomic nervous system, which we have nervous system disorders. Brain is nervous system. What I love about the beamer is it's really, not the beamer, but this machine, this pulse electromagnetic, there's many brands, is that I have something in my home that resets my brain. When I'm really scrambled up and I can't function and I can't talk and I can't walk, which still happens, I can get on this machine and in 8 minutes, I'm hit my reset button. I've seen this consistently happen with people with brain injuries that I've put it on. I think this is amazing. I think all the rehab centers should have one. And so for me to have this in my house is what is allowing me to function so well, because I'm doing it twice a day, and I'm constantly getting back to kind of baseline so I don't get so scrambled I'm gone for a week. Today I'm here with Dr. Sergio Azzolino in San Francisco, and thank you so much for being with us here to share your amazing information with everybody. As you know, I've been on a 6-year search involving many different modalities and many different doctors trying to figure out how to heal from my traumatic brain injury. And I have found something that I'm really excited about here at Dr. Azzolino's office. He's a neurologic chiropractor or a functional neurologist. And I would say after working with him, I have gotten so much better. And that was 6 months ago, and I've maintained that. So I'm really excited to hear, what you are, if you could explain to us what you do.
Sure.
And how that's unique and how it helps people with brain injury.
Sure. The correct term is actually chiropractic neurologist, is what you're going to most notably see out there. It can be synonymous with what we call functional neurology also. Functional neurology and chiropractic neurology really started about 25 years ago with the guidance of Dr. Frederick Carrick, who was really the father of functional neurology. And back then, the things that we were talking about and doing seems quite esoteric, and they're pretty much mainstream now in regards to looking at the brain from a very functional perspective. And so the one thing we do know is that the brain is very dynamic. It's constantly changing, constantly taking information from the environment through our eyes, our ears, and our senses, and our joints and muscles. And one thing we commonly see with traumatic brain injuries is people have a loss of function. As we've spoken about so many times, people are unfortunately treated based on their symptoms rather than being assessed for their function. So the one thing that we'll do as chiropractic neurologists is a very in-depth evaluation, testing a variety of parameters from balance and coordination to reaction times, simple reaction times to cognitive functions. All are very tangible, very objectively tested. We utilize a variety of different equipment, as you've utilized some of this for rehab, but also we have quite a bit of equipment that we can use for diagnostic purposes. One thing we look at is the speed, the reaction time, the accuracy of eye movements, and all these various things allow us to get a good window on where one's area of weakness is. Once we identify the area of weakness in the brain, then we could formulate a very specific and customized rehabilitation protocol to address those areas of weakness.
And that's one of the things that you do that seems so unique, is it's very specific and it's very pinpointed to what's happening with that particular patient.
Absolutely. It's all very specific. There are not two people that come out of a traumatic brain injury with the exact same symptoms and the exact same deficits. And the key, once again, is identifying what deficits the individual has and what rehab will be appropriate to get them back to full function.
And it seems like one of the keys of how you're working that's unique is using the VNG to diagnose what's happening. So the video nystagmography, is that how you say it?
Correct. Video nystagmography.
Thank you. And I've been to so many doctors in the past, and they would do that test that shows you what's happening with your eyes, and they would just go, well, it's abnormal. End of conversation.
Sure.
Nothing we can do about it. And you've taken that one step further, which I find really fascinating.
Sure. When we know what normal function and abnormal function is, then we could utilize that tool to look very specifically on what is working optimally and what isn't. And certainly there's a variety of different eye exercises, a variety of different vestibular exercises, and different coordinative type exercises that you've done that can very specifically change that function.
Yeah.
And so there's not a shortage of things. And you're right, most people are utilizing the VNG from only a diagnostic perspective. And our group of chiropractic neurologists and functional neurologists are really taking that to the next level to have it be a very informative tool on function.
And so looking at what happens on that tool, on that test, you can see what kind of exercises the person needs to be doing.
Yes, and understand that is only one aspect of the evaluation, but in you it was very particular and very, very helpful in identifying things like your reaction time, your visual reaction time, your hand-eye coordination, a bit slower, and as a result, we could program machines and different type of exercises to very specifically change that hand-eye coordination, to change that visual reaction time.
Yeah, great. And then some of the other tools that you use are things like the blood tests to see what's happening
Sure.
in the whole body.
Well, the key is really getting a good window of understanding of where you're at physiologically. So,
Okay.
as you know, with yourself, we start with the neurologic evaluation, and it's very objective. You know, there's a lot of people out there that are attributing brain function to some esoteric things, and not to take anything away from them, that's helpful, but you could assess the brain through some very objective tools and get a really accurate assessment of where things are at. Beyond that, we need to make sure you're having all the appropriate nutrients to your brain, and so looking at blood work is extremely important. And as you know, one thing we look at very closely are infections and different chemical toxicities that can affect one's ability to heal.
Yeah. And I personally have found those objective tools to be super helpful, because having a brain injury, you can't really tell if you're better or not, or where your deficits are sometimes. So having this objective tool to say, here's where I was when I started and here's where I am now, is really powerful.
It's very powerful. It's very powerful for your sake in knowing where you were, but more importantly, to guide us in treatment.
Yeah.
Because if we only go off of you saying, I have a headache or I'm dizzy, and we don't know what the source of that is, we don't know how to specifically rehab you.
Yep. And do you find people with traumatic brain injuries who do this kind of rehab, I mean, that they're improving, that can they get all the way better, or is just this kind of like the next step of improvement?
The majority of people get 100% better. You know, the sooner you identify one's weakness and treat them, the better off you're going to be. And as you know, in our clinic, it's a multidisciplinary clinic. We have a medical physician that specializes in this also, and a couple of naturopaths. And so we look at the full spectrum,
Yeah.
from the neurologic rehabilitation component to the nutrient component to utilizing IV nutrients for protective measures to utilizing hyperbaric oxygen to promote healing, and to address and looking at other testing, as I said, with infections and toxicity to address all that. So once again, no two people with a head injury have the same problem,
Yep.
and the key once again is identifying what the individual needs. If we treat head injuries rather than treating individuals that have head injuries, our results may greatly vary. But if we treat individuals that have had head injuries and we really spend the time and effort in evaluating what their system needs, the probability of success is great.
That's great. It's really important for people to have hope and to know that they can make improvements. So that's really great. So if somebody had a head injury and was looking for somebody who does what you do, the chiropractic neurology,
Yes.
where would you suggest that they go look for that?
The biggest database for that is the American Chiropractic Neurology Board. The acronym is ACNB, American Chiropractic Neurology Board.org. Right on there, there's a doctor locator. We have chiropractic neurologists throughout the world. Not everybody is trained in traumatic brain injuries. We have, beyond the basic level of chiropractic neurology, the specialization in chiropractic neurology, we have people that have gone through years of additional training in traumatic brain injury, as I have. And so you should certainly ask those individuals if they've had the appropriate training, and they should be able to answer that objectively and honestly.
Great. Good. Is there anything else that you'd want to mention to people who have a traumatic brain injury?
There's plenty of hope, and there is really no need to suffer. And as you know, you've spent a lot of years searching for the right answers, and it's great that you're doing this service to educate people, because too many people stop searching
Yeah.
after a couple years. The world is opening up their eyes right now to the causes, to the predisposing factors, to the pathophysiology of traumatic brain injury, so there's more available each and every day. But I would really encourage people to find practitioners that are skilled, that don't need to do the research to find the answers, that know these things, because there are many people that have a great deal of clinical experience in dealing with this. So number one, find practitioners that are skilled, and find practitioners that can really give you an objective basis for what they're going to do with you. And as you know with yourself, the evaluation is very telling. It's very telling about what your deficits were, and the repeat evaluations show what deficits have improved, and gives you a guidance on what needs to be done from a rehabilitation perspective.
Yeah. So it sounds really hopeful. It sounds like, to me, it seems like even in the 6 years that I've been involved with this, there's been so much emergence of new technology, new information, new healers. It feels like we're on the verge of a neuroplasticity kind of revolution. And
We are.
thank you for being one of the leaders in that.
My pleasure.
Thanks.
Thank you.
Okay, so look at your left hand on the mirror, and you're gonna tap your fingers in a rhythm. 5, 3, 4, 2, 5, 3, 4, 2. And you imagine that it's your right hand, okay? Your actual right hand, you can just have it rest, or you can do it at the same time. But always keep looking at that mirror.
The Beamer that I was going to show you on the movie is $6,000. I have found a model that I like even better that starts at $3,600. It's called the IMRS. I have one. I'm going to offer all of you guys a free session on it. It's at my house in Shelburne, and oh, dang. I'm going to pass around this paper, and if you give me your email list, I will notify you, and you can get a free session. How about that? You can also come and do sessions on my Beamer if you want to do more, or I'll think about renting it. I don't know if I can. I'll have mine for a while. So I have them available for sale. I'm really passionate about this, so I'm going to be making them available for people. So you can contact me if you need more information.
And you said the IMRS is better.
Yeah, it has more bells and whistles, and it's cheaper.
Does insurance have-
No, but here's how I got to do a lot of these things in the last year. So cost is a big issue for us. We're not working. Cost is a huge issue. Okay, so I've got just a few minutes. I want to cover my most important thing. I'm going to skip through some of this. Contact me if you want more information about the pulsed electromagnetic machine, and or you can talk to me afterwards, or if you see me today, about any of this. So here is my number one, most amazing choice for healing your brain, chiropractic neurology. Who's ever heard of that? The chiropractor in the room has heard of it. Hardly anybody else. So I apologize, I'm going to have to go through this quickly. It was developed 30 years ago by Dr. Ted Carrick, who now runs the Plasticity Brain Center in Orlando, Florida. If you can get there, I would do it. It's the cutting edge of brain injury rehabilitation. It's an individualized approach. You go there for 5 days. They will work you hard for 5 days. They will work on repairing your brain function, not just alleviating your symptoms. They look at your whole body. They look at your blood work, your nutrition, your hormones, the inflammation, blood sugar, nervous system. They give you visual exercises and balance exercises. So this is where they have this incredible advantage, and we're so smart. Remember that whole test about follow your finger? So that's a pretty crude test if you're just using your eyes to look at somebody else's eyes. The chiropractic neurologist looks at a video nystagmography, VNG test. When I went to a doctor, they did this test, and they looks at, you wear the goggles and it shows you what your eyes are doing, and the doctor said, yep, that's abnormal. End of conversation. Neurologic chiropractor went, all right, let's see what's happening with your eyes. They put this on, and they could pinpoint exactly where in my brain was having a hard time, and then they could pinpoint exactly the exercise that I was to do that day. So I did this 8 hours a day, these exercises 8 hours a day, worked with them pretty intensely, took breaks, felt horrible afterwards, but it really helped. Then the next day, go in and do the VNG test again, see, because your brain is plastic, where are you today? Because you've done already improvement. So it just builds on each other, on itself over the course of 5 days, which is amazing. So you're going to do this intensive week of very precise brain exercises. This isn't like, one size fits all approach that we tend to get. It's specific to what's happening with you. And it gets followed up with home exercises and treatments at home in collaboration with your primary care doctor. I want to show you real quick the exercises that I was doing.
Yeah. Oh, wow. Let's go straight next to you. Go and just step down.
Five, 3, 4, 2. And you imagine that it's your right hand, okay? Your actual right hand, you can just have it rest, or you can do it at the same time. But always keep looking at that mirror.
I can tell you I felt really crappy at the end of each day. There was no dinner, there was just fall apart. I felt really crappy for about a week afterwards, and then I woke up and went, oh my God, I have no more brain fatigue. I have no more brain fog. Here we are doing a puzzle backwards.
Your actual right hand, you can see your right hand. Just have it rest. Actual right hand,
We work up to this.
just have it rest.
Here we are, unparalyzing my right hand to a metronome.
Now imagine that it's your right hand, okay? Your actual right hand, you can just have it rest, or you can do it at the same time.
So, if you want to learn more about chiropractic neurology, I think the local person is Court Vreeland in Norwich. And I think that Dr. Bill Schenk also knows quite a bit about chiropractic neurology. He's getting a thumbs up. Awesome. Good. So, yes, Bill Schenk in Williston. If you are needing a reference of where to go somewhere, if you're across the country or for somebody across the country, you can call Dr. Azzolina's office. He's the vice president of the American Chiropractic Neurology Board, and they'll tell you who has expertise. Because like any other field, you don't just go to any chiropractic neurology, you need to find somebody who understands brain injury. And then Dr. Rutherford's videos again, and this book again. And I'm going to finish by thanking you all so much for being here and cheering you on this path. I know it's the hardest thing ever to be on this road of healing a brain injury. And I just want to tell you these things in case nobody's told you today. You are beautiful. You are loved. You are needed. And you're alive for a reason. You're stronger than you think, and you're going to get through this. And I am glad you're alive, so don't give up. Thank you.
Than the wreckage you see, there's more to be. I'm still